Hi everybody, Dr. Bryton here, Tooth Tip Tuesday. Today we got a fun one. We're going to be speaking about a bacteria called P. gingivalis, which I'm sure you all are very familiar with. Actually, probably not. So today I will educate you on that. But before I do, I want to speak about having your teeth cleaned every 6 months. Many of you are probably not aware as to why you do that, but traditionally 6 months is the time frame by which you get your teeth cleaned, because we understand that at that time frame bacteria changes in the mouth and gets to a point or levels that are high enough to increase your risk for things like cavities and gum disease. So if we get your teeth cleaned every 6 months, we can reduce the risk for things like cavities and gum disease. But from there, I want to go back to P. gingivalis. P. gingivalis is a bacteria that is normal to the mouth, even a healthy mouth, but it's overpopulated in the state of gum disease or periodontal disease. It's one of the 5 major bacteria that contribute to gum disease. And in particular, P. gingivalis is one of the main reasons why gum disease patients get their teeth cleaned every 3 months, because through studying P. gingivalis, we have found that it populates or repopulates on a 90-day cycle or a 3-month cycle, anywhere from 3 to 4 months. And so as a result, in patients where gum disease is occurring, we want to make sure that we clean out that bacteria and stay ahead of its repopulating. So in addition to that, it's good for our patients to be aware of that in this past January, a study was done on dementia patients' brain cells, and they found that 96% of the brain cells, an enzyme that is only made by P. gingivalis, was present. That's a big deal. See, P. gingivalis is also indicted in other areas of the body as being harmful, directly from the mouth. They have found that in patients that have gum disease, we're at a 2 to 3 times higher risk for heart attack or stroke or a cardiovascular incident. In addition to that, postmenopausal women are found to be at an increased rate for breast cancer of 14%. In addition to that, we know that patients that have gum disease have more trouble controlling blood glucose, and so it's indicted in diabetics as well. As a result, patients with gum disease get their teeth cleaned every 3 months, so we can lower the risk of those sorts of things, and that's part of the reason that we treat gum disease. But in addition to that, we need to know a key feature to P. gingivalis. It is an anaerobic bacteria, which means it hides in areas where there's not oxygen. It doesn't like oxygen. One of those areas is deep pockets. And so, in general, a mouth that has pockets of 1 to 3 millimeters, so those little measurements that we do around your teeth, measuring the bones, those pockets of 1 to 3 millimeters, those are healthy, those are good. The reason being, you can clean them. At home, we know that the best toothbrusher or best flosser can only get to 3 millimeter depths in their pockets. Anything greater than that needs a professional cleaning. But in addition to that, anything greater than that is exactly where P. gingivalis will go hide. So, what can we do to protect ourselves from P. gingivalis and its harm? Things we can do. Make sure that we are brushing twice a day. Make sure that we are flossing daily. And make sure that we have personalized cleanings. So for those of you that have been diagnosed with gum disease, make sure that you're getting the right treatment. Make sure that you are being seen every 3 months and having those pockets thoroughly cleansed. Those of you that have pockets that are deeper than 3 millimeters but haven't been diagnosed with gum disease, maybe you've got a 4 millimeter pocket. Maybe you need to have your teeth cleaned more regularly in order to reduce exposure risk to things like dementia, things like diabetes, things like heart disease, because we know they're all related. So that's my Tooth Tip Tuesday for you. I had a really fun prop that I wanted to show everybody, but for a second it seems like I lost my head. That was a joke. All right, hope you all have a wonderful rest of your week. And I will tell you, the Mansfield house is pretty excited this week. We are waiting on a baby, so we're getting close. So I just want you to know we are having a good time here. We look forward to taking care of you. If you ever have questions, give us a phone call. Or if you want to reach out to us via email or Facebook, do so as well. If you like this, please like it, share it. If it can help somebody, I'd love to. So hope you have a great rest of your week. Thanks so much.